All right, we just started recording this webinar. Once again, welcome everyone. So we got a good attendance. I think many more people will attend as we progress. Now, as I normally respect people who are here on time, I respect you guys because you are here on time. So I think I should not penalize you waiting for the other people who couldn't make it. Now, I respect everyone, also the owners, traditional owners of this land, where we are actually hosting this webinar, although we are located in different part of the planet. And also I like to respect and honor those people who sacrifice their life uh, because of these current situations in different ways, and also grateful that through those experiences, we were able to learn a lot about the current pandemic and to deal with them the best possible way that we could. Now, as you all know, the pandemic has caused a number of issues over a period of time. I just went through some of the latest statistics just to get some perspective into the conditions and how serious the problem is. There are 472 million COVID-19 cases reported. They were the reported cases in the world, and up to last 24 hours or so. And then out of which 6.08 million deaths been reported. Now, these deaths may not be necessarily directly from COVID. It may be COVID associated or associated with other comorbid disorders and the COVID. In Australia, although there are worldwide 472 million cases, we had 3.9 million cases and about 5,736 deaths reported. So out of 6.08 million deaths in Australia, we have got 5,736 deaths. So it's a small amount in comparison to the bigger picture. So we are one of the luckiest in the sense. So I look at the number of countries where the largest number of deaths were, some of it due to the population, large population as well. Obviously, USA is the leading in relation to the number of deaths. Out of 6.08 million, I think about 1 million coming from the US, and other 5 million actually divided among various other nations, where the Brazil is the second, and so on and so forth. Now, one of our neighbors, which is Vanuatu, has got only one reported deaths. Now, that's a good situations. And also New Zealand, our neighbor, has got 163 deaths, not million, 163 deaths. So they are quite lower numbers in comparison to the universe. So this is give some sort of perspective. Now, in 2019, I look at that. What are the common causes of deaths in the world? 2019, according to the World Health Organization, 9 million deaths were due to the heart diseases. And then, of course, 6.2 million deaths were stroke. But pretty much similar number of deaths now happening with the COVID as well. In relation to the 2019 statistics says 6.2 million deaths were due to stroke. So now pretty much the similar number of deaths happen as a result of COVID-19. Now, with that said, now let me introduce you to the speaker today to talk about the Ayurvedic perspective of COVID. That is why you are here for. So I will introduce to Dr. Leenu. Dr. Leenu is actually one of the very young, dynamic Ayurveda practitioner from India. She's still actually doing these presentations graciously from India. She is a MD and also a graduate from the SDM College of Ayurveda. She is also faculty member, assistant professor, and also consultant physician in Ayurveda. So I know she has spent a lot of time and efforts to produce these presentations, as well as to prepare for this presentation for you, to give the current information. She has done some research as well with the current information, because as you know, the countries like India has got very established Ayurveda education system. So there are a lot of work they have done in relation to that. Some of the research findings are not published yet, but I think she should be able to give some insight. So without any further ado, ladies and gentlemen, let me introduce you to Dr. Leenu to do the presentations with the perspective of COVID-19. Yes, Leenu, over to you.
Hello. So am I audible?
Yes, you can. You're
Yes,
fine. All good.
yes, sir. So first of all, I thank Dr. Sharat sir for this great insight and great introduction to this webinar. So with no much,
Lino,
yes,
yeah, could you? Yeah,
yes,
good.
yes, yes,
Okay.
yes.
Okay.
So with no much delay, let me begin the presentation. So yes. So is the PPT visible? Is it clearly visible? So you all can
Yeah,
just,
all
yeah,
everything okay. You can go
yes,
ahead.
sir. Yes, sir. Okay. So Shri Gurubhyo Nama, with the blessings of Almighty and with due salutations to all my gurus and acharyas, I welcome each and every one of you all for this webinar on the topic Unraveling the Ayurvedic Perspective of COVID-19. So, as you all know, the present pandemics has brought all the human activities to a standstill, and in fact, it has forced the entire mankind to seek seriously for its cause and solutions. Well, if you consider Ayurveda, pandemics are not a new topic of concern to Ayurveda. In fact, Ayurveda has documented its valuable experiences with regards to pandemics thousands of years ago and has rightly termed them as Janapodo Dvamsa Vikara, that is, the contagious diseases or communicable diseases which affect the large group of people. So, with this background, uh, let me begin the presentation, and the highlights or the key areas that would be focused in this webinar are a short review on the modern perspective of COVID-19, followed by an in-depth explanation of Ayurvedic perspective regarding the root cause, clinical features, its stages. Then we have the management protocol, followed by preventive aspects. So first, have a short look into the brief overview of the COVID. So in December 2019, there were a cluster of pneumonia cases that were reported in the city of Wuhan in China. And the early cases that were reported had a history of visiting or marketing live animal market. And this led to the discovery of novel coronavirus. Initially, the coronavirus was seen within the Wuhan or in the parts of the China. Later on, it was spread across the globe. And as on 30th January 2020, WHO declared this outbreak as public health emergency of international concern. Now, what exactly is this coronavirus? So, it is nothing but a large group of virus which has this central genetic material and which is surrounded by a lipid envelope with protein spikes. So this very appearance will give it an appearance of crown, and crown in Latin refers to corona, and that's how the virus gets the name coronavirus. And if you look at the natural reservoir, animals are considered to be the natural reservoir of the coronavirus, and it can transmit to other species or other susceptible host, and specifically it is the humans due to a range of factors, and this event is referred to as the spillover event, and it can be due to the excessive interaction between the animals as well as the humans as that of a zoonotic event, and it could be due to the mutation of virus. And if it affects the humans, then humans are presenting with respiratory symptoms as that of ranging from common cold with that of severe disease. And as you all know, till date we have had three outbreaks of the same coronavirus. Number one, it was in China 2003, it was SARS coronavirus. Number two, it was in Saudi Arabia in 2012, that was MERS coronavirus. And the present pandemic, that is the outbreak of novel coronavirus. And if you look at the symptoms, normally it takes about an average of 5 to 6 days for the symptoms to appear. And most of the time, the patients are considered to be asymptomatic, and very few patients presents with very mild to severe symptoms, as that of fever, fatigue, and respiratory symptoms like cough, sore throat, shortness of breath, and likewise. Some people may also present with loss of taste or smell, even the development of skin rashes, and in severe cases, we have the presentations of pneumonia, organ failure, and even death. So, now, what Ayurveda has to say about or in the understanding of this infectious disease. So, if you look at Ayurveda, it has a very unique method of approach towards diagnosing any disorders, or it could be a psychosomatic disease, or it could be a somatic disease. It could be a freshly emerged disease or an existing one. So, it could be any disease. Ayurveda follows a formula, a three-step formula by which you can diagnose any set of disease. And they are: number one, it is Vikara Prakriti. So here Vikara refers to the illness or disease, and Prakriti refers to the nature. So it is nothing but nature of the disease. So we are looking at the typical features or signs and symptoms, or the typical characteristics a disease exhibits. So based on this, we can identify or diagnose a disease. Number one. Number two, it is the Adhisthana Antara. Here, Adhisthana Antara refers to site of the disease. So based on the site of the disease, means the disease could affect tissues or dhatus or organs, srotas, that is body channels, likewise. So based on the affliction of the disease, we can understand the in-depth details about that disease. The third factor or the third element is Samuttana Vishesha. So here Samuttana refers to the etiological factor, and Vishesha is nothing but the specific. So here nothing but it is the specific etiological factor or specific cause of the disease for aggravation of the dosha. So we will be looking into what dosha and what gunas likewise. So now let's see how we can apply this formula to the understanding of COVID. So we are going with the first step, that is Vikara Prakriti, nature of the disease. So as you all know, based on the mode of transmission, we know that COVID has two main characteristics. Number one, it is considered to be highly contagious. That is, it has high transmissible rate. Number two, it is pandemic. That is, it affects a large group of people or a great community of people at one point of time. So these are the two main characteristics we have seen based on the mode of transmission of COVID. And same thing we can apply as per Ayurvedic understanding. So number one, it is considered to be Aupasargika Roga. So if you split this word, Upa, Sarga, Roga, put together it is Aupasargika Roga. So Upa here refers to near, Sarga here refers to contact, and Roga here refers to disease. So these are nothing but a set of diseases that occur due to close contact or due to proximity. And further, Ayurveda text has enlisted four main factors or four modes of transmission. Number one, they say is Gatra Samsparsha. So Gatra Samsparsha is nothing but the physical contact. Number two, it is about Nishwasa. Nishwasa is nothing but by exhalation. It is nothing but we can correlate with the droplet infection, maybe through the acts of coughing, talking, sneezing, likewise. Number three, it is about Saha Asana. So Saha Asana, literally the word meaning refers to sitting together, but we can also interpret it as overcrowding, right? And the fourth factor is nothing but Vastra, Mala, Anulepana. So Vastra is nothing but the clothes, Mala is nothing but the garlands or ornaments, and Anulepana, it's like, the accessories or some creams or the applications. So it is nothing but you can interpret this way. If you share the personal belongings of an infected individual, you are prone to such infectious diseases. So these are the 4-step factors what they have told in the context of Aupasargika Roga, that is contagious disease. Now, let's look into the pandemic as a whole. So, when you come to Ayurveda, we have the concept of Janapada Udvamsa Vikara. So, if I split it, Janapada refers to large group of people or a community of people. Udvamsa refers to destruction or affliction, and Vikara is nothing but disease. So, put together, it's nothing but disease which affects a large group of people. So now I have a question for you all. Now, what may be the cause for this mass susceptibility, or what could be the reason for a great number of people to get afflicted with such diseases at one point of time? Any answers from your side?
You could actually post your answers in the chat box.
Okay. Okay. So uh, I'll look at the answers later on, but um, let me go to the next slide. Okay.
Leenu, hear me? There are multiple answers. Do you want me to read the answers for you?
Yes, sir. Just.
Yeah, just few answers. Basically, people are saying it could be stress, low immunity, living in close proximity, overpopulations, virus, question mark, manasa, or the fear, strength of the disease, overpopulations, blah, blah, blah. So these are some of the examples you can work on.
Okay. That's good. That's good. But I want to tell you all that it is nothing but the common factors what individuals share together. Okay. So what are the common factors that people share together? Okay. Yes, so it is nothing but the life forces. We have this air, water, land, and season, right? So if these are affected, then people will be affected in large. And we have the same principle told in Ayurveda, that is Sadharana Hetu, that is the common factor wherein a large group of people will be affected, right? So common factor, we have two concepts, common factor and an uncommon factor. So common factor is responsible for causing such pandemic diseases, whereas uncommon factor, that is again a different set of idea and principles that is very specific to an individual because of his immunity and likewise many other principles. So here the answer is the air, water, land, and season. So I'll explain about this in the next coming slides, right? Yes, next going with the second principle, that is the Adhisthana Antara. So here Adhisthana Antara refers to site of the disease manifestation. So here we will be understanding a disease based on the symptoms observed, the signs and symptoms based on the features or typical characteristics, and we get to know about the underlying system or srotas, that is body channels, or the tissues, the dhatus that they are involved. So based on the symptoms, we come to know that this system or this body channel or this srotas is afflicted, and this is how we come to know the srotas or the system involved, and this will help us to plan the treatment appropriately, right? We have a set of srotas chikitsa. For example, for respiratory we have this set of treatment. For vatavaha, that is nervous system, we have a set of treatment measures likewise. So this makes it a bit easy for the physician to understand the disease and further execute the treatment. So the same thing is being told. So as far as COVID is concerned, in the initial stage, usually patient presents with the symptoms as that of rhinitis, cough, sore throat, or breathlessness, which all are suggestive of the involvement of pranavaha srotas. It is nothing but respiratory system. Next, we have people or patients presenting with the symptoms of fever and fatigue, ideally suggestive of Rasavaha Srotas, that is circulatory system. We can also include lymphatic system, right? Next is the loss of taste and smell sensation. So here Vatavaha Srotas is involved. So you might ask how Vatavaha, uh, whether there is a Srotas called Vatavaha Srotas. Yes, there exists a Srotas called as Vatavaha Srotas too. So this has been told in the Sushruta Samhita. It is a text written by Acharya Sushruta. So when he explains about the body system and channels, and further when he talks about the illness Pakshagata, that is stroke or cerebrovascular accident, he tells about the sensations, the primary functions of Vata dosha. He says that Vata is the main dosha that is responsible for the perception of the senses or sensory functions. And that's how we can attribute the loss of taste and smell sensation to the Vata Vasrotas or nervous system, right? And even few patients will present with skin rashes, which is highly suggestive of Raktavaha Srotas, that is circulatory and integumentary system is involved. Then few patients may also present with diarrhea or gastrointestinal disturbances, which is highly suggestive of GI tract or the Purushavaha Srotas. So as I told in the initial stages, so based on the lakshanas, you will come to know about the srotas or the system involved. But in the advanced stages, what happens is that if no proper treatment is being given, or if the immunity of the individual is considered to be very much low, then patient may present with all the involvement, the multiple involvement of srotas, the dhatus, that is tissues, the body channels, and likewise further presenting with multiple organ failure and likewise complications. Now let's focus on the third principle, that is Samuttana Vishesha, that is based on the specificity of the cause of the disease. So as per Ayurveda, Ayurveda believes that even though there is the presence of virus or bacteria, until and unless there is no imbalance, or until and unless there is no visheshan of dosha in the human body, disease can never happen. So this is nothing but susceptible host. So this is the primary causative factor for the disease to happen. So Ayurveda considers that the dosha imbalance is the prime or the primitive factor that is responsible for any disease to happen. And in Ayurveda, we consider it as Sanni Krishta Nidana. Nidana is nothing but the factor. Sanni Krishta is nothing but the primary causative factor. Nidana is causative factor, and Sanni Krishta is the primary or the primitive immediate causative factor. And if you look at the presentations of COVID patients, we have seen a lot of Vataja and Kafaja Prakopa Lakshana, that is the signs and symptoms with regards to Vata and Kafaja dosha is being seen most of the time. And Vata and Kapha is considered to be the main dosha that are responsible for the patient to develop COVID. And some of the risk factors what we are identifying is Vata Kapha provoking diet and lifestyle. So if a person indulges in day sleeping, Divaswapna, what happens? Kapha Prakopa will occur. That is, aggravation of Kapha dosha will happen, and further it may complicate. Likewise, if you consider age factor, Vataja extreme age, that is nothing but the elderly individuals are affected on the large scale. Similarly, if we consider the diseases, so Vata Kafaja diseases with special regards to maybe chronic respiratory diseases, wherein you have the involvement of Vata and Kapha dosha, diabetes or Prameha, even Vata Kafaja is the main dosha that is responsible. Likewise, these are some of the examples for the risk factors that we can consider or understand as per Ayurveda. Now, the next risk factor is the seasonal variation. So if you look at the seasonal variations, so the spring season, winter season, and the rainy season, These are the three seasons wherein the aggravation of Vata and Kapha happens. Okay, so Vasant, Varsha, and Shishira. It's in Ayurveda. So same thing. It's the spring and the winter and the rainy season. Especially if it's in India, it's usually in the rainy season that we have seen the surge or the peak of the COVID cases, and that's how we can say about the seasonal variations contributing towards the occurrence of the illness. Next, after saying this, I would like to say about the second important or the remote causative factor. So the reason for mass susceptibility. So as I told, Janapododvamsa, that is the pandemic diseases, if it has to occur and if it has to affect a large group of people, then what is the main reason? It is the common factors what the people or what the individuals share with. It is nothing but the air, water, land, and season. So if these life forces or the natural resources, natural elements are contaminated or polluted or vitiated, then patients are prone with airborne diseases, waterborne diseases, likewise. Okay, and what is the root cause for all these contamination or pollution of all these natural resources? It's nothing but adharma, right? So adharma is nothing but unlawful acts. So here when I say about law, it is referring to the natural nature laws that governs or sustains the principles of nature, right? It is not about the country laws. So for the all these unlawful acts to happen, again, what is the root cause? It is nothing but the mind of a human being, right? So mind of the human being is considered to be the main origin. So most of the time, as per Ayurveda, we say that most of the diseases occur at the mind level, and we can understand it as prajna aparadha. Out of three disease causative factors, we have prajna aparadha. That is, prajna here refers to intellect, aparadha refers to offense. So put together, it is nothing but intellectual offense at the level of mind. Patient or a human being may misuse the natural resources, perform in unlawful activities as that of destruction of the life forms or contamination or pollution of air, water, land. Likewise, it may have an effect on seasonal irregularities or seasonal variations, and this is how we have the outburst of pandemic affecting large group of people. So these are the two main concepts or the cause for the COVID disease to happen, right? Now, after saying this, I would like to draw your interest towards the insight into the root cause. So as I told, human mind is considered to be the primary reason wherein after this he performs all these adharma or unlawful illegal activities as that of misusing natural resources. What happens is that there will be contamination of air, water, land, and there will be seasonal irregularities. And further, it can disease can happen in two levels. Number one, it is dosha vaishamya. So in Ayurveda we say that if anything or any disturbance that happen in environment, it will have an adverse effect on the human body and human mind, right? So if there is abnormalities in the life sustaining principles in the environment, it will have an adverse effect on the human mind and body, and there will be the imbalance of dosha. This is seen as imbalance in the dosha, thereby leading to agni mandya, that is the weak metabolism, thereby causing low immunity or ojakshaya. Ojas is nothing but the essence of all the seven dhatus or seven tissues, thereby leading to low immunity, right? And this status, wherein patient or people presenting with low immune status, they are prone for all these kind of infectious diseases as that of COVID-19. So this is one level of understanding. Apart from this, the second level of understanding, what happens with the misuse of natural resources. So if man indulges in displacement of the natural habitats of life forms as that of plants and animals. Especially there will be excessive zoonotic event as that of spillover event, as I told in the previous slide, from the natural reservoir, the virus which is present in the natural reservoir, that is animals. What happens is that there will be a spillover, there will be transmission of this virus from animals to humans. And this itself, we have a real life example that has happened in the Hunan wildlife market, and what we are suffering now, that is the outburst of pandemic, right? So this is the understanding, or the details about the root cause. Now, if you consider such pandemics, we can understand it under Adi Devika Vyadi. So, as per Ayurveda, for the disease classification, we have three set of diseases. It is Adi Bhautika, Adi Atmika, and Adi Devika. The first two, that is Adi Bhautika and Adi Atmika, are the diseases that are caused due to the imbalance in the body and in the mind. Whereas the third one, which we are dealing with now, is nothing but Adi Devika Vyadi. So here, these are the diseases which are occurring because of the disturbance in the natural resources or the life sustaining principles, and these are considered to be the major disasters that which affect the common factors, air, water, land, season likewise. And examples for this are outburst of pandemic and even cyclones, floods likewise, or heat wave, right? So this is an understanding of the classification of the COVID as per Ayurveda and its root cause. Now, having said this, I would like to draw your attention towards the clinical features. So usually what happens is that patient presents with the signs and symptoms, and they come to OPD, and initial first 4 to 5 days, we can see the presentation of fever and cough. So these are the two symptoms that is very commonly seen in the patient. Apart from this, we know that corona has different patterns of presentation. It has presented itself in different way. So that is different thing. But most of the time, statistically, if you see, usually the patient presents with fever and cough. So as an Ayurvedic practitioner, what we have to do is we need to understand the doshic involvement. So what is the dosha involved in these signs and symptoms? So I have given two examples, right? Number one, it is evaluation of dosha in fever. So if a patient presents with irregular fever that which fluctuates with severe body pain, then it is highly suggestive of the involvement of vata dosha. Whereas in case of person who presents with high fever that which goes above 100 degree Fahrenheit, which is persisting and which presents with burning sensation like symptoms, then it is highly suggestive of pitta dosha. In a case wherein there is low fever, that is manda jwara in Ayurveda we say, presenting with heaviness, fatigue, right? So it is nothing but angaglani or gurutva in Ayurveda. We say there is the involvement of kapha dosha. And irregular fever with high temperature, that is the combination, is highly suggestive of the involvement of vata and pitta. Irregular fever due to vata, high temperature due to pitta dosha. And similarly, we have irregular fever with low temperature. It is highly suggestive of the involvement of vata and kapha dosha. And if a person presents with fluctuating fever, that is at times it is low fever, at times it is severe, then it is kapha pitta dosha that is involved. And in case of sannipataja or tridoshaja, there is different doshic presentation. So far what we have seen in the patient is the vata kaphaja, that is irregular fever with low temperature in the second and third stage. In the first stage, it is irregular fever with high temperature. So you can understand each and every patient based on the doshic evaluation. So once you understand the doshic involvement, you can appropriately plan the treatment, right? Similarly, so initially first to 4 to 5 days, patient presents with fever, and in case if there is no appropriate intervention or treatment is not given to the patient, then what happens is that usually the symptom of cough is going to aggravate, and we have to identify the nature of cough based on the doshic evaluation. And I've given few of the examples as that of, in case of vata dosha involvement, there will be severe cough which will be without the sputum, which will be very dry, and the frequency will be more. And in case of pitta dosha, there will be mild cough with sticky sputum, and it will be yellowish in color. Okay, so pitta will exhibit yellowish discoloration, sputum, and with fever. And in case of kapha, there will be mild cough with excessive, a large bout of cough or sputum will be there. So this is how the doshic evaluation will help us to understand in planning appropriate treatment. So further, you all need to understand each symptom in this way, right? And plan accordingly. Now let's move into the clinical staging of the COVID. So usually what we have seen here is the first stage is characterized by the involvement of vata and pitta dosha, and it is referred to as vata pitta dominant stage. And here there could be the presence of ama, okay, or without the ama. So ama is nothing but, you all know, it is the toxins or metabolic byproducts, and there are many understanding for that, so I'm not going in detail with that. So in the first stage, there could be or there may not be the presence of ama. And the clinical features, usually we have irregular high fever with dry cough, and patient will be very weak. In the second stage, it is the vata and kapha dosha that is predominant. And again, here there could be or there may not be the presence of ama, right? And here the symptoms or the clinical features are irregular fever, irregular low fever with productive cough. So productive, why? Because there is the involvement of kapha dosha. That's how the cough will be with large bouts of phlegm. Then the patient might also present with weakness. In the third stage, vata kaphaja dominant stage, but what happens here is there is the association of ama, that is the presence of sticky kind of substance in the channels or in the srotas. So what will happen if the ama is present? Because of its stickiness, it will obstruct the channels, right? And this will obstruct the flow, the normal flow of vata dosha, and vata dosha will have an reverse flow presenting itself with breathlessness or dyspnea. So this is a complicated stage. Okay, so because of the involvement of ama, there will be stickiness, there will be blockage of the channels or srotas, and presenting or obstructing the normal flow of vata dosha. And here we can see patients presenting with breathlessness or shortness of breath. Okay, in case of fourth stage, there will be the involvement of all the three doshas, the vata, pitta, and kapha dosha. All the three doshas will be involved, and even here we will have the association of ama presenting with severe complications, and that is mainly because of the involvement of other dhatus, the deeper dhatus or the deeper tissues, and involvement of agni, involvement of other body channels. And in the fifth stage, if active and good treatment is given to the patient, usually the symptoms will subside, and usually patient presents with nirama stage, that is without the ama. And the lakshanas of or the signs and symptoms of this stage would be lightness of the body. So if there is ama, there will be heaviness that will be seen in the third and fourth stage. In case if it is nirama without the ama, then there will be lightness, there will be increased digestive fire, patient will feel enthusiastic, the energy levels start coming up. So these are highly suggestive of stage of resolution. So this is how we have identified as per Ayurvedic perspective. Now I shall speak very shortly about the treatment guideline. So what are the measures that you are supposed to do? I will not be going in detail with the herbs and other management as that we do here in India. So the general line of management. So in first stage, it is vata pitta dosha that is involved. So what you have to do is you have to plan the treatment which is very specific to vata and pitta pacifying measures. So herbs, medicines, diet and lifestyle modifications, everything that is pacifying vata and pitta has to be implemented. And one more thing what you have to note is that you have to plan with vata anulomana, that is facilitate the movement of the vata dosha, right? So some medicines to facilitate the normal movement, the normal downward movement of vata has to be prescribed here. In the second stage, it is Vata Kaphaja dominant stage. Here, Vata Kaphaja pacifying measures with regards to the herbs, medicines, diet, and lifestyle modification has to be carried out with special attention to facilitating the movement of downward movement of Vata dosha. In the third stage, what happens is that there is the involvement of ama. It is vata kaphaja pradhana, that is vata kapha dosha is involved, and there will be the involvement of ama presenting with shortness of breath or dyspnea as complication, right? So here we plan with vata kaphaja shamana, that is shamana chikitsa. The specifying measures for vata and kapha, number one. Number two, since there is the involvement of ama, we have to do the ama pachana or ama nirharana. So we will be advising some of the digestive and carminative herbs or medicines in this stage. And the lakshanika chikitsa, since it is a stage of complication, we will be planning with lakshanika chikitsa, is nothing but the symptomatic treatment. So for example, shwasa, or that is breathlessness is present here. So we will be going with shwasa hara chikitsa. So we have a detailed explanation of what to be done in shwasa or breathlessness. There is an entire chapter uh, dealt in the Ayurvedic classics, the measures that has to be followed. So all those lines of treatment has to be implemented here. One such example, what I can say is that application of Nadi Sweda. Okay, so initially you will be applying the medicated oil of Saindava and Saindava Lavana and Taila, Tila Taila. So sesame oil with the salt you will be mixing. So there's a special kind of salt called as Saindava Lavana. So you can mix this and you can apply. You need to heat it a bit and you need to apply over the chest and followed by Nadi Sweda. So what happens is that the stickiness of ama, what we ideally see in this stage, it will be cleared off, and there will the obstruction what we see in the channels will be cleared off. Also it will help in the normal movement of vata. So this is a lakshanika chikitsa, symptomatic treatment. It is giving high results. We have few of our Ayurvedic practitioners in the rural districts of India wherein they are only planning with Ayurvedic treatment. And once we do this kind of treatment, what happens is that the oxygen saturation rate is going up. So these are some of the crude techniques that we have in Ayurveda. So I will not detail all this. There is mentioning of many such things to be done very cautiously. All these measures have to be done very cautiously because it is a stage of complication. You have to monitor the vitals of the patient. You have to be very alert. So anytime anything can happen. So it needs special caution and alertness, right? So this is how what our Ayurveda classics have told with regards to the shwasa chikitsa, that is dyspnea or breathlessness treatment. Now we also have in the fourth stage there is the involvement of tridosha, that is all the three doshas will be involved, and there will be the presence of ama dosha. Also there will be the involvement of deeper dhatus, right? Deeper dhatus, and Agni will be very low, hampered, and the all other srotas, the Udaka, Prana, all the other srotas will be affected here. And what happens is that in this stage, it is considered to be a stage of high complication, and patient presents with all those the fatal signs of the COVID disease. So here it is very difficult to treat, but if planned cautiously and meticulously, yes, we can achieve, we can clear or we can help in the patient to reverse the disease. And in this stage we have to ideally plan the tridosha shamana chikitsa, that is the measures to specify all the three dosha, and it is going to be a bit difficult because all the three doshas will be involved. So based on the symptom severity, you have to grade whether it is vata, whether it is pitta, whether it is kapha dosha, and based on that we have to plan the treatment. Along with that, amapachana and even atyayika chikitsa also can be given. So I just want to mention, some of our Ayurvedic practitioners, they have given in this stage, especially when they don't respond much, when their oxygen saturation is going very low, what they have done is they have prepared some medicines and they are applying in the form of anjana. Anjana is nothing but the eye application, collyrium. So this is one of the best route of administration. This will help to increase the oxygen saturation, and the drugs that are used is the bilvadi gulika. It is nothing but egal marmalose drug, and they triturate, they do the bhavana with ajamutra, that is the urine of the sheep, and this is considered to have high therapeutic effect, and it enters the sukshma srotas, the minute channels, and the rates, the oxygen saturation rates have come up. So these are some of the principles of practice what our practitioners are following. Just wanted to mention it. I'm not going in detail. And apart from this, what we can do is nebulization. We have this concept of inhalation, steam inhalation and nebulization. We can also plan with tulasi arka. Arka here refers to the distilled formulation. Okay, any formulation if it is obtained by distillation. So we can plan with the tulasi. Tulasi is nothing but basil. We can also plan with barangi arka or tambula arka. So these herbs are considered to be the best herbs or drug of the best medicine of choice for the respiratory infection, right? So all these we can collect and we can plan accordingly. Of course it is going to be a bit difficult, but need to plan it meticulously, cautiously, after assessing the doshas, right? Once uh, all these treatment have been given, and if patient with good immunity, and if there is the subsidence of symptoms and there is the absence of ama, then it is considered to be the stage of resolution. Here the vyadhi shamana occurs, that is the subsidence of symptoms happens, and the disease will be reversed. And what you have to plan here, so here you have to ideally observe the patient for all the symptoms to occur. So in the third and fourth stage we had those symptoms of ama. Here there is the increased digestive fire or increased appetite, the energy level of the patient will be increased, and even patient will feel lightness. You have to look at the tongue, so all this tongue coating and everything will be cleared off. So all this patient observation has to be done, and ideally you have to plan with the rasayana therapy. So here rasayana therapy is nothing but it is a rejuvenation therapy, which is a disease specific rejuvenation we advise. So this I'll be detailing in the coming slides, right? Yes. So just I want to have a short review on the concept of immunity in Ayurveda. So immunity in Ayurveda is described as vyadhi kshamatva. Okay, vyadhi kshamatva, and it can be understood in two levels. Number one, vyadhi utpada pratibandhakatvam. So here vyadhi means disease, utpada means occurrence, pratibandhakatvam means the preventive. So here put together it is nothing but the preventive aspect of immunity. Okay, preventive aspect of any disease. Okay, this is the first level understanding of immunity, and the second level understanding is vyadhi bala virodhitvam. So even though there is a disease, what we have to do is the strength of the disease has to be opposed, or we need to reverse the disease progression. This is nothing but by the concept of curative. So the concept of immunity in Ayurveda mainly focus on these two principles. So here mainly for this webinar I'm mainly highlighting on the preventive aspect, which is considered to be very easy, cost effective and profitable, right? So I'm mainly focusing on the preventive aspect. And so the preventive guidelines, we have a number of guidelines told in Ayurveda, but first and foremost is Nidana Parivarjana. So here Nidana is nothing but the etiological factors and Parivarjana is nothing but avoidance. So avoidance of the etiological factors. And this is nothing but that I discussed in the context of Aupasargika Roga. I told you all the four mode of transmission, right? Just avoid those four mode of transmission. Number one, it is Gatra Samsparsha, that is maintain physical distancing. Number two, it is Nishwasa. I told it as by exhalation or by droplet infection. It is the people tend to get COVID, right? So what you have to do to avoid Nishwasa, you need to wear mask regularly or cover your nose and mouth during the acts of sneezing and coughing. Next we have is Saha Asana, that is nothing but over crowding or sitting together. So this is again the third mode of transmission. Just avoid this. Fourth one is nothing but the Vastra Mala Anulepana, that is don't share the personal belonging with others. So all these concepts, what the present like we have the guidelines for COVID appropriate behaviors, same thing has been told in Ayurveda. So this is the beauty of Ayurveda, the principles itself, right? The Nidana Parivarjana and all those principles what they've given, this is the beauty of Ayurveda from the preventive aspect. And next, our acharyas have given about the concept of sanitization, and here they have told about sanitizing the hands and personal belonging with sanitizers. So there is a mentioning of Agada Udaka, that is a herbal preparation, and they have referred it as sanitizer, right? It is told in Sushruta Samhita text written by Acharya Sushruta. Next, we have this, sanitizing the surrounding or the environment by beating the drums applied with medicated medicines or medicated formulations as that of Shara Agada Dravya. Okay, so this will help to sanitize your surrounding. Now, third concept is regarding the personal hygiene by regularly washing hands before eating, touching the nose and mouth, and it can be done by a preparation called as Siddharthaka Snana Churna Kashaya. So it is a decoction made of Siddharthaka Snana Churna. It is a herbal preparation. So with this, you can utilize it as a sanitizer. And the fourth one is the Dupana Karma. It is nothing but the Dupana refers to the fumigation. So fumigating the room by using some of the Dupana Dravyas as that of neem or any such antiviral herbs and medicines mentioned in Ayurveda. So this will help the prevention of airborne infection. So this is how you're not just focusing on the person as such, but you will be focusing on the environment, right? You will be sanitizing the environment too from this preventive measures. Now, the other measures that is told in the preventive aspect we have is Ritu Shodhana. That is nothing but Ritu is nothing but season. Shodhana is nothing but the detox. And this concept of seasonal detox or seasonal administration of detox therapy is highly applicable in case of healthy individuals or even in disease individuals we can give. So that's why we have another name for it as Swastha Panchakarma. So that is the Panchakarma therapies that are utilized in an healthy individual. So as you all know, there will be the seasonal aggravations of doshas. For example, in Vasanta Ritu, that is spring, there is the aggravation of Kapha dosha. So ideally, we plan with Vamana, that is emesis therapy. In Varsha Ritu, there is, that is monsoon, what we say, there is the aggravation of Vata dosha, and Basti or enema is the ideal treatment that we give. And in Sharad Ritu, that is nothing but the autumn, there is the visheshan or aggravation of pitta dosha. That's why we plan with virechana and raktamoshana. So by doing such therapies, panchakarmas, as per the seasonal aggravation of dosha, what happens is that the mula vaikrita dosha or the root cause of any disease or the main Vaikrita, vitiated dosha will be removed. Shodhana is nothing but elimination, right? It will be removed out of your body. What will happen? You will have the prevention of the illnesses and you will have a great immunity. So these are some of the crude concepts of Ayurveda that we can practice from the preventive aspect. Now, third point is regarding the ahara and vihara. That is, ahara is nothing but diet, and vihara is nothing but lifestyle modifications. So, when we say about diet, Ayurveda has a unique concept of Nitya Sevaniya Ahara, that is nothing but the balanced diet, and there is a list of the food that is being given. For example, we have to consume milk, ghee, gooseberries, and shashtikashali, that is rice that is kept for 60 days, or the preserved rice likewise. So we can add the food predominant with six rasas, six taste, that is sweet, sour, salty, katu tikta kashaya, that is bitter, astringent, and pungent. So all these, the food predominant with all these rasas are considered to be ideal, and it will maintain the doshas in samyavastha, or it will help to maintain the balance of dosha. Accordingly, one has to take dosha prashamana ahara, that is as per his prakriti or his doshic aggravation, or as per the seasonal variation, one has to consume the food. And sevana vidhi vidhana, it is nothing but the dietic rules or code of conduct, what they say, that is, you should have the food in a peaceful mind, you should not hurry, you should not laugh. So likewise, we have a set of rules what they have told. So by following all these things, what happens is that there is uh, a great level of immunity that is seen in an individual. Also, it will help to maintain the balance of the doshas. And we have the lifestyle modifications in the method of following a daily regime, that is dinacharya. So getting up at around 45 minutes before the sunrise, so ideally, and doing all those cleansing therapies, as that of eye wash, or nasal installation, or oil pulling therapies. So all these things, if you do, and evacuation therapies, right, simple therapies, what happens is that you can maintain the doshas, you can keep the doshas in check. And with regards to the sleep, what specifically what I want to convey is that avoid day sleeping, that causes the kapha prakopa or kapha vitiation, and avoid night straining. So night straining, what happens is that it causes vata dosha prakopa, the aggravation of vata dosha. Two things, okay. And ideally, have a good and sound sleep for about 6 to 7 hours, okay, ideally. So these are considered to be the best measures. And apart from this, follow yogasana and pranayama. So we have a set of yogasanas that have been told, and pranayamas, specifically as that of nadi shodhana pranayama, kapalabhati. So all these things will help to keep the doshas in check, number one, and it will enhance the vital capacity of the lungs. So all these bodily postures or these pranayama, the main effect is towards the enhancing the system that is involved, that is the respiratory system, okay. So that is the main focus of yogas and pranayama. Of course, there's a lot to tell if I have to speak about yogasana and pranayama, but due to time constraint, I'm just skipping all those things. Right now, the last method from the preventive aspect is the rasayana. Rasayana is nothing but the rejuvenation therapy. And here, for the body, we are planning with Ajasrika Rasayana. So Ajasrika Rasayana is nothing but, just understand it in this way, that is balanced diet with predominantly six rasas. That's it. Okay. So any food, if you have with all the six rasas, with regards to the Nitya Sevanya dravyas, that is milk, ghee, rice, gooseberries, and all these things, is considered to be the Ajasrika Rasayana. So everyday intake, if you take diet in such a way, it increases your immune power. Second one is Vyadhi Prashamana Rasayana. That is nothing but, Vyadhi is nothing but disease, Prashama is nothing but to suppress, and Rasayana is nothing but the rejuvenation. So these are a set of medicines or herbs that is disease specific. It has rejuvenation, or it increases the vital functioning of all those targeted tissues or organs. And for the mind, what you have to do, So ideally follow the concept of Achara Rasayana. So we have a set of ethical regimen, okay, code of conduct that has been told, since time immemorial in the Ayurvedic literatures, to be truthful, to be in harmony with nature, and all those set of rules and regulations follow that. So by following all these things, what happens is that Sharira Abhisamskara. So Sharira is nothing but body, Samskara is nothing but transformation. So there will be the immune power that will get enhanced, and it promotes the vitality or the optimal status of the health. So this is how the preventive measures will help you in preventing the uh, infectious diseases as that of COVID. Now, let me quickly glance through the immunity boosting measures for self care that is given by the Ayush Ministry. So, they say that frequently can go with the intake of warm water throughout the day, and practice of yogasana, pranayama, and meditation for at least 30 minutes a day, and incorporating turmeric, cumin, coriander, and garlic, all these things in the cooking. So it will help to keep the doshas in check and enhance the immune power. And apart from this, they have also mentioned about some of the oral intakes in the form of Chavanprash. So Chavanprash is nothing but it is an immune tonic, right? Immune tonic. So that is mainly made of amalaki, that is gooseberry, and it has to be administered 10 gram, that is 1 teaspoon in the morning. And we have other preparations as that of golden milk. So golden milk, the name because it appears yellowish, golden yellow in color, so that's why it is referred to as golden milk. So here, just take a glass of milk and add half a teaspoon of turmeric powder to it. So you can take this once or twice a day. And turmeric is considered to be having antiviral properties, and that's a reason, and it helps in the uh, kapha dosha aggravation, and that's why they have ideally told about the golden milk. And apart from this, you can also make preparations as that of herbal tea, consisting of basil, cinnamon, black pepper, dry ginger, and raisins. Okay, so all these oral intakes the Ministry of Ayush has mentioned. Apart from this, we have some of the simple Ayurvedic procedures as that of nasya. Okay, nasya is nothing but nasal application. So and you have oil pulling therapy, that is nothing but the kavala or gandusha, what we say in Ayurveda. So ideally you have to do this as a cleansing therapies. Okay, so with sesame oil, coconut oil, or with simple cow's ghee, you can do this. So what happens is that it is like a sthanika chikitsa or localized treatment. So virus gets into your body, so it prevents the first level entry of the virus at this level. So by performing all these local simple Ayurvedic procedures, it will prevent the first level entry of the virus, it will prevent the multiplication of the virus, right? If you regularly do this, it is considered to be very good. It will help to keep the doshas in check also. And apart from this, they have also given some of the guidelines with regards to dry cough and or sore throat, that is steam inhalation with that of mint leaves or ajwain, that is karawai seeds. Once a day you can practice. And apart from this, you can also have the clove powder with honey, or even with sharkara, that is the sugar. You can take this 2 to 3 times a day. So this will help to keep the vata and dosha, kapha dosha in check. So these are some of the ministry guidelines, and they have also issued some of the guidelines for the post-COVID. So after a person has contracted the COVID, and once he has done with the disease stage, what happens with him or her is that they are prone with some of the complications as that of uh, lung complications. For example, there will be fibrosis, and even there will be high level of stress, anxiety, insomnia, and such mental illnesses, and even weakness or general debility. So for all these complications, Ayurveda has told about the implementation or usage of rasayana, that is rejuvenation therapies. And the Ministry of Ayush says about the intake of ashwagandha, it is nothing but Withania somnifera, and it has to be ideally taken. You can start with 3 gram till 6 gram a day. You can go for about 15 days or for about a month. And even Chavanprash, we mentioned it in the previous slide. So here you can take this 10 grams with water, warm water or milk once a day. So this Chavanprash you can continue for a long time also. And maybe ideally you can go for 45 days, and at the most it is 3 months. Then you need to have an alternate uh, changing over to the next Rasayana drug. So Rasayana drugs can be taken for a longer time, but based on the doshic level in the patient. Okay, so we won't administer for a long period of time. Based on the doshic level we give it. We can give the combination. We can also give alternate uh, administration of rasayana. For example, first month we can give with ashwagandha, next month you can go with yashti madhu, glyceria glabra or licorice, next month you can go with agastya haritaki, likewise. So there is different understanding, or based on the presentation of the patient we can plan this. And the ministry has also mentioned about rasayana churna. So rasayana churna is nothing but powder. Rasayana is nothing but the rejuvenation powder. So the aim is for rejuvenation, and it is nothing but a herbal preparation consisting of Tinospora cordifolia. It is nothing but guduchi, and Embolica officinalis is nothing but amalaki. Tribulus terrestris is nothing but gokshura. So all this in a mixture. So 3 gram powder twice daily with honey, or even for 15 days or for a month. So these can be administered for the post-COVID complications, right? Now, let's quickly go through the best practices of Ayurveda. I know I'm short of time, but let me just quickly go through these best practices of Ayurveda. So we have this unique concept of Ayurveda that is nothing but Rasayana. So Rasayana here refers to the nourishment of Rasa Adi Saptadhatus. That is, all the Rasa is the first Dhatu. From all the 7 dhatus will be nourished, and it will enhance the agni, it will enhance the ojas, and it has the function of sthana apunarbhava chikitsa. That is, rasayana is one such specific modality of treatment wherein it aims at strengthening the affected or targeted tissue, organ or system. So if you look at the Ayurvedic text or literature, in after mentioning each disease, in each disease context, they end each disease with the mentioning of rasayana, herbs or medicines. So that is the beauty of Ayurveda. So why they have mentioned it likewise is so as to prevent the recurrence of the disease. So especially in case of COVID like infectious diseases, there is this recurrence of the illness and post COVID complications, and patients are prone to have the series of episodes, right? So in order to prevent the recurrence of the infectious diseases and to strengthen the affected organ, we have this unique concept. It is only in Ayurveda we have seen, and that's a beauty again of Ayurveda. So it is nothing but sthana apunarbhava chikitsa, what we say in Sanskrit, right? And here specifically I'm going to deal with rasayana herbs for COVID. So these are some of the important or the medicine of choice for COVID infection. And number one, it is ashwagandha rasayana, that is Withania somnifera. Number two, it is amalaki rasayana, that is gooseberry. Number three, it is yashtimadhu rasayana, licorice or glyceria glabra. Guduchi rasayana, that is Tinospora cordifolia. And vardhamana pipali rasayana, that is long pepper, piper longum. So all these are considered to be the best medicines in the case of COVID. The main reason being, if you look at these herbs, these are mentioned either in one or the other formulation with regards to the Shwasa Kasa, that is the respiratory diseases, or Vishama Jwara, that is the viral fevers, or the complicated fevers or fevers of unknown origin. So these are some of the herbs that are mentioned as rasayanas in those contexts in the Ayurvedic literatures. So same thing you have to collect, and you need to advise or administer it in churna, that is powder form, or kshirapaka, that is milk decoction, or based on the palate susceptibility of the patient, you can advise it in any form, and you are going to get great result because of its immune modulatory function. And also, if you look at the Guduchi and Vardhamana Pipali Rasayana specifically, our practitioners are giving it in the post-COVID liver complications, because Guduchi and Vardhamana Pipali has specific, functions towards liver. Okay, along with the immune modulatory function, it has some specific or key functions over the enhancing the liver functions. So that's why the practice of Guduchi and Pippali Rasayana is administered. So there are a lot of things to mention, so I'll just move on with the other things. And one more concept is Swarna Prashana. So if anyone asks me what is the concept of immunization in Ayurveda, yes, we have an answer: Ayurvedic method of immunization. So it is usually started from the infants till 16 years of age. They do it every month, and it's a combination of medicine wherein honey and some herbs as that of vacha, guduchi, and many other herbs is given, along with the purified, incinerated, the gold ash and ghee. So these are formulated, and it is been given in 1 to 2 drops, and this is done in a large scale practice in I think almost all parts of India, because in even in small settings, right from the clinic or to the large scale hospitals, they practice this Swarna Prashana, and we have got a great or significant results in the immune modulatory function, or it could be enhancing the strength and vitality of the kids, or even it prevents the recurrence of the illness, specifically as that of respiratory infections, and it thus helps in the overall development. And we have had 25 plus clinical trials on Swarna Prashana conducted in children, and it has revealed all these effects. And just two studies I'm mentioning, the recent studies. One was carried out in Gujarat in 2019. So they have proved the immunomodulatory effect of Swarna Prashana in infants, and even in BHU Varanasi. So these are the national institutes of Ayurveda in India. So here the study was carried out in 2020 on the effect of Swarna Prashana in children. So we have all these statistics or evidence-based studies on Swarna Prashana. So these are not just, the concepts that is written in Ayurveda. So it is put into practice. So I just want to make sure that things are, we have all these great concepts and evidence-based practice for all these concepts in Ayurveda being followed even now, right? And finally, I'm just updating you all regarding the research studies on COVID-19 undertaken by the councils or the institutes under the Ministry of Ayush. So far, total studies we have had is 142, and these are the other status of the studies. And preventive studies 46, interventional studies 44. So likewise, we have all these studies, the details of the studies that has been conducted in Ayurveda. So the intention behind putting up this slide is just to draw your interest or attention towards the evidence based practice. So it is not just verbal. So things are put in practice, and we also have a great or significant results that is obtained from Ayurveda, right? Now I would like to conclude this session by asking you all a question, that is, what is the permanent solution for these kind of pandemics? So I just want you all to reflect on this question, and you can just answer if you all are interested, or just reflect it. And even though I have discussed the whole concept, yes, you can just reflect on it. And finally, I conclude by saying that this is one of my favorite shloka from the Charaka Samhita, that is Tyagaha Prajnaparadaha. So I will be just mentioning the first line, right? Tyagaha Prajnaparada refers to, I told this word Prajnaparada when I told about the insight into the root cause, right? So Prajnaparada, that is intellectual offense. So human mind is the main culprit for all these diseases to occur. So tyagaha means avoid this intellectual offense and everything will be fine. So by saying this, finally I conclude by saying that the concept of Ayurveda is not just focused on curative aspects, rather it revolves around the preventive aspects, and thereby it will help in promoting the overall wellness or overall upliftment of the health in an individual. And the preventive aspect is considered to be very easy, very profitable and cost effective, and it's very easy to practice also, right? And to maintain the optimal health of an individual, we need to have a holistic approach at three important levels. Number one, it is at the level of body, by uh, uh, following a great diet and lifestyle. And number two, it is at the level of the mind, that is following the ethical regimen, the code of conduct. And the last and the most important is at the level of the environment, that is the surrounding that we live in. That is to live in harmony with the nature, to preserve the nature, to uplift the natural life resources. So, with this, I thank the organizers, and thank you, Dr. Sharat sir, for this great opportunity. Yes.
All
So,
right, that's great. What a great presentation, Leenu. I know. I think that was really throat provoking, and then you have brought some complex matters into simplicity in a short period of time. I know that if the time is given, you'll be talking more and more. I'm sure that all the people who participated got a heck of a lot of benefit out of that. So once again, I really thank you for doing this presentation for us, for our students, as well as for the prospective students and for our graduates. If you do have any questions, please feel free to type that on the chat box. I'm sure Leenu will be here with you to answer any questions. So I'm going to actually post the or stop the recording now. You can ask any questions if you have. We are more than happy to respond to them.